Hello, and welcome back to How to Input Data in Health Facilities Costing with Win Morgan. We're going to be working this session on treatment procedures, which is the third step in data input for your costing tool. You'll find this input area at step 3 of the INTS costing tool. You're going to be working with the treatment procedures for 3+ years old and under 3 years old. You're going to be putting check marks in each of the procedures that are going to be used for each case type for INTS non-complicated, INTS severe non-surgical, INTS severe surgery required for both fully sensitive and multi-drug resistant types of cases. You'll see on the left-hand side that the initial procedures and curative procedures that are possible for this age group are listed. And for each of these procedures, we're going to be filling in the check boxes which are relevant procedures for each of these types of cases. Make sure that those are the types of procedures that you collected when you were interviewing the health workers. You can see here that for INTS non-complicated, for both fully sensitive and multi-drug resistant, we have an outpatient comprehensive exam. And that's because INTS non-complicated usually is handled outside of the hospital in an outpatient visit. Secondly, you will see that we have INTS severe non-surgical cases for fully sensitive and multi-drug resistant cases. And for those that are severe enough, you're going to have an inpatient intake so that that person will be admitted into the hospital. Similarly, for INTS severe cases where surgery is required, you will have an inpatient intake. So you'll see that we've checked those boxes that are relevant to each of those types of cases. When you get to the curative procedures, you'll see that for first-line antimicrobials, that for INTS non-complicated cases, and for INTS severe cases, and for INTS surgery required cases, that you use the first-line antimicrobials in each case. When you have multi-drug resistant cases, those people will be given first-line antimicrobials before they are given second-line antimicrobials. For second-line antimicrobials, you'll see that for each of the types of cases that are multi-drug resistant, we have also checked the box for second-line antimicrobials. In the case of inpatient resuscitative care, which is non-surgical, for that procedure, we have limited that to the INTS severe non-surgical cases. So you can see that we've checked the box for both fully sensitive and multi-drug resistant cases for them to receive inpatient resuscitative care, which is non-surgical. When you move down to the surgery required cases, though, those, whether they're fully sensitive or multi-drug resistant, are going to be receiving inpatient intensive care surgery preparation, surgery for abscess drainage or other major complications, and inpatient intensive care post-operative care. So what we've done here is make sure that the procedures that are available are being applied to the right types of cases. And this is for the 3-year plus cases. When you get to the under 3-year-olds, you have the same situation. So that under 3-year-olds who are going to be handled on an outpatient basis, they get an outpatient comprehensive exam, whether they are fully sensitive or multi-drug resistant. Those who are considered to be worthy of getting INTS severe diagnosis, either surgery required or non-surgical, will have the inpatient intake exam. And so you'll see that those have been checkmarked for both INTS severe non-surgical and INTS severe surgery required. For the curative procedures, you'll see that for the first-line antimicrobials for under 3-year-olds, both the fully sensitive and multi-drug resistant cases will be getting the first-line antimicrobials. And that's whether it's non-complicated or severe non-surgical or INTS severe surgery required. Those who have multi-drug resistance will also then get the second line of antimicrobials, while those people who have fully sensitive cases are getting only the first line antimicrobials. Inpatient resuscitative care, non-surgical, is reserved for those cases that are INTS severe non-surgical, whether fully sensitive or multi-drug resistant, as you can see here. For those patients who are under 3 years old who may require surgery, we also have procedures that include surgery preparation, surgery for abscess drainage or other major complication, and inpatient intensive care post-operative care. And those are checkmarked here for all of those INTS severe surgery required cases, whether fully sensitive or multi-drug resistant. That's how to enter the data for procedures, and we'll move on to the next session.